When should you use different splint types for patient care? Imagine you're at the scene of a fire rescue and a person has a suspected broken leg. You need to act fast and choose the right splint to keep them safe. The type of splint you pick can make a big difference in how well the patient is stabilized and how smoothly they are transported. Knowing when to use each kind is key to good patient care during firefighting and rescue operations. First, static splints are your go-to for most injuries. They are rigid supports made from materials like fiberglass or plastic. Use static splints when you need to immobilize a suspected fracture or soft tissue injury. They are great for temporary stabilization before further medical treatment. For example, if you suspect a broken arm but can't confirm it yet, a static splint will keep the arm from moving and prevent further damage. These splints are simple to apply and help reduce pain and swelling during transport. Next, traction splints are designed specifically for femur fractures. If you see a patient with a painful, swollen mid-thigh injury that looks deformed, a traction splint is the best choice. It works by pulling gently on the leg to reduce muscle spasms and realign the bone. This reduces pain and controls bleeding. Traction splints are only used when the fracture is isolated to the femur and there are no other leg or pelvic injuries. They come in two main styles, one that requires two rescuers to manually apply traction and another that is a single-post device that can be quickly attached. Always check the pulse, sensation, and motor function after applying a traction splint to ensure blood flow isn't compromised. For burn injuries, static progressive splints are used after initial treatment. These help prevent contractures, which are tight scars that can limit movement. They are used during rehabilitation to stretch and position the skin properly. They are not for immediate stabilization but are important for long-term recovery. Inflatable air splints are useful when you need to quickly immobilize limbs during rescue. They can be inflated around an injury to provide support fast. But be cautious with air pressure, especially during air transport. Changes in altitude or temperature can cause the pressure inside the splint to increase, risking tissue damage. Always monitor the patient for signs of circulation problems like cold or bluish skin. Vacuum splints mold to the shape of the body part. They are perfect for complex injuries or hard-to-fit areas. Just place the splint, mold it to the injury, and remove the air to create a firm support. They are especially helpful when standard splints don't fit well or when dealing with irregularly shaped injuries. When positioning the limb, remember to splint in the natural, correct position unless resistance or circulation issues occur. If you notice signs of poor blood flow, gently realign the limb to restore circulation before transport. This can help prevent further damage and make transport safer. Children need special attention. Pediatric splints are smaller and adjustable to fit their tiny bodies. Using the right size ensures proper immobilization and comfort for young patients. In rescue situations, your goal is to prevent additional injury. Choose the splint type based on the injury pattern, patient condition, and available equipment. Always reassess circulation, sensation, and motor function during and after splinting. If symptoms worsen or the patient feels discomfort, communicate with medical personnel and be ready to adjust or remove the splint if instructed. Proper splinting helps keep patients safe and makes your rescue operation more effective.